Welcome to This Explainer. What if I told you that handing a smartphone to a young child is now being viewed by top medical professionals as literally the equivalent of handing them a lit cigarette? Seriously. Today, we're diving into a monumental shift in how the UK's top doctors are viewing social media and exactly why they're starting to call it the defining public health crisis of our time.
Okay, let's dive into this. Here is our roadmap for today. We're going to start with the new big tobacco, move into clinical risks and harms, explore the legislative debate, look at screening for harm, and finally, wrap up with practical parent steps.
Starting off with Section 1, the new big tobacco.
So, for years, the whole debate around screen time was kind of vague, right? People often pointed to a lack of long-term data. But that narrative has completely fractured. Just look at this quote. The Academy of Medical Royal Colleges, and keep in mind they represent 23 different medical bodies across the UK and Ireland, states that this issue ranks alongside smoking and wearing seatbelts in cars as a unifying force for the medical profession. They are explicitly calling out a structural conflict of interest here. They're explaining that a tech company's profitability is actively, directly competing against a child's well-being.
Now, what's really interesting about this is how the strategies compare. Former UK Health Secretary Wes Streeting recently argued that big tech is actively borrowing the big tobacco playbook to avoid regulation. But there's a key difference. While tobacco relied on a chemical hook, nicotine obviously, tech platforms rely on a psychological one. They use AI algorithms, infinite scrolling, and highly personalized feedback loops to trigger dopamine releases by design. It's an attention economy, and it creates these compulsive usage loops that developing brains simply cannot break.
And the exposure starts shockingly early. According to recent reports, 1 in 5 children aged just 3 to 5 in the UK already have their own phone. 1 in 5! And more than a third of children in that exact same tiny age bracket use social media. I mean, these are the true digital natives, and we are basically handing them unregulated access to handheld supercomputers before they even step foot in a primary school.
Moving on to Section 2, clinical risks and digital harms.
And this brilliantly illustrates what healthcare professionals are actually seeing in their examination rooms right now. Young people themselves are the ones sounding the alarm. In the Royal Society for Public Health's Status of Mind report, users actually noted Instagram's positive impact on self-expression. But look at the staggering negative weight placed on absolutely crucial health factors. We're talking anxiety, depression, sleep deprivation, body image issues, and the fear of missing out, all significantly worsened by the platform's core design.
But, it goes far beyond just anxiety. It bleeds into actual physical trauma. Doctors are treating severe facial burns on children who are attempting social media challenges. They're admitting 15-year-olds who are taught by online communities exactly how to hide their eating disorders. And perhaps most disturbingly, a recent study found that 43% of sexually active 16 to 17-year-olds reported being strangled during sex. Young people are replicating extreme, violent, pornographic content that they view as normal. It's a horrifying reality that's allowed to fester simply because platforms fail to safeguard minors from abusive content.
When surveyed by the Royal College of Pediatrics and Child Health, the numbers paint a pretty stark picture of what's happening on the front lines. 49% of pediatricians cite self-harm and suicidal tendencies as their biggest concern regarding social media. 45% point to severe bullying, and 39% to anxiety and depression. Clinical professionals are deeply concerned that these algorithm-driven systems are just completely displacing healthy developmental activities. Things like getting enough sleep, learning, and real-world face-to-face socializing are getting pushed out.
And to make matters worse, this digital addiction literally feeds right back into traditional physical addictions. Data from the Understanding Society study revealed that youth spending 7 or more hours a day on social media are an astonishing 8 times more likely to smoke cigarettes and 4 times more likely to vape. Researchers point out that algorithmically controlled advertising heavily promotes products like vapes to individuals who literally cannot legally buy them.
Let's move to Section 3, the legislative debate.
To protect long-term public health, the UK government is currently weighing 2 main paths. On one side, you have campaigners demanding a total ban on social media for under 16s. This is very similar to the model Australia is implementing to protect their children. On the flip side, some experts argue that total bans are a bit of a sledgehammer technique that might just force kids into darker, completely unregulated spaces like Discord. Instead, they advocate for treating tech firms like cinemas, enforce existing laws, and align platform algorithms with the British Board of Film Classification. That way, teens receive the exact same high safety standards applied to age-rated films.
Now, whether it ends up being a ban or strict regulation, some very specific technical safety features are actively on the table. Proposals include forcing apps to disable autoplay, halting infinite scrolling, stopping location sharing for minors, restricting those personalized algorithms, and enacting mandatory nighttime curfews. Actually, right now, as we speak, hundreds of British families are actively testing social media bans, app curfews, and time limits just to observe the real-world behavioral changes in their kids' sleep and schoolwork.
Section 4. Screening for digital harm.
So the crucial point is, while lawmakers are locked in debate, doctors have to deal with the patients sitting right in front of them today. Consultant child psychiatrist Dr. Emily Semmer notes that mental health services are completely inundated with referrals for anxiety, sleep disorders, and challenging behaviors that are caused directly by time spent online. She warns that doctors are effectively being forced to pathologize what is in reality a completely normal childhood response to continuous exposure to hateful, manipulative content.
To combat this massive lack of systemic data, new clinical guidance is stepping up. It requires doctors to routinely inquire about tech access and screen time history during regular checkups. Honestly, it's exactly how they would ask an adult about their diet, alcohol consumption, or smoking habits. They need to proactively screen for early signs of digital harm. And crucially, they have to record this data. This matters because it's literally the only way the medical community can properly map out and treat these unhealthy relationships with technology on a large scale.
And finally, Section 5. Practical steps for parents.
So that covers what's happening in the hospitals and the legislature, but what can you do in your own living room right now? Well, interestingly, children themselves absolutely recognize the danger. When the Royal College of Pediatrics and Child Health actually sat down and engaged with youth, the kids' top tips were to find balance, control screen time, and, quote, don't get addicted. Kids actually want boundaries, you guys, and families are fully capable of building them.
Rather than just imposing draconian absolute bans, which, let's be honest, usually just cause massive conflict, experts suggest using these 4 daily conversation starters to negotiate healthy limits. Number 1, is screen time in your house controlled or is it a free-for-all? 2, does screen use interfere with what your family actually wants to do, like eating meals together? 3, does it disrupt sleep? And 4, surprisingly, are you controlling snacking during screen time, given the obvious links to obesity? Let's move on and see how this builds into a very practical checklist for establishing healthy habits. 1. Sit down, make a plan, and stick to it consistently. 2. Actively prioritize face-to-face interaction to help build that crucial social resilience. 3. Protect sleep at all costs with a hard curfew. We're talking absolutely no screens for at least 1 full hour before bed. And 4. Be mindful of what is being consumed both digitally and physically while scrolling.
I want to conclude with this incredibly powerful thought from Dr. Sear. Looking at this totally unregulated digital space that is built entirely for profit and engagement, she says, children should never have been expected or allowed to navigate this world alone. It's so true. Digital natives need structured adult protection, just like they do when crossing a busy street.
We now know the data. We know exactly how the algorithms are built. If social media is purposefully designed to be as addictive to a young developing brain as tobacco is to a smoker, what specific boundary will you set today to protect the digital natives in your own life? Thanks for joining me on this explainer, and I highly encourage you to start those family conversations tonight. Catch you next time.